and welcome to the Nurses and Hypochondriacs podcast, Dr. Owen Muir.
Hi there. Thank you so much for having me. This is fortuitous.
Yeah, I'm so excited to have you on and talk about our wacky chaos that's going on with United Health, with Optum, and then we have other amazing topics to talk about. But before we start, let's talk about you. Who is Dr. Owen Muir?
So I kind of dropped the doctor.
I know. I love that
Possible.
I was like, no worries. I
Yeah.
love Owen Muir, because I could tell that from your TikToks. I could tell that from your email. There's some doctors that are new that I've encountered. They're like, call me doctor,
Yeah.
and I'm just like, dude, seriously, I've been doing this for 3 decades.
Yeah. I mean, so I have an MD, and I am a distinguished fellow of the American Academy of Child and Adolescent Psychiatry, because I'm a general and child and adolescent psychiatrist by training. I identify as an interventional brain medicine doctor, and my career has focused on the intersection of technology, particularly artificial intelligence,
I love it.
in diagnosis and brain stimulation. It didn't start that way. I thought I was going to be a schizophrenia researcher, and I was wrong. I'm married to another physician, Carlene McMillan, who is also a child psychiatrist. We met at Disney World.
I love that.
And we have 8-year-old twins, Trent and Quinn, who are the bestest. So that's the story. I am a physician. I do some business things, and I am an NIH grant funded researcher. And I'm really interested in payment models because it turns out if you don't pay for it, no one can get it.
Yeah, and your TikTok went viral. You had like a
Yeah.
million views, you said. So let's
Yeah.
talk about that. Let's talk about everything that's going on with United Health and Optum, which I worked on an Optum project in 2019, and it was AI based, EMR based, machine learning based. And I didn't know anything about all that stuff. I learned it. And now I'm just blown away at what's going on because this is not what we were working on. It was, and I'll tell you more about the project as we go on. But let's go ahead and tell us about what's been going on with all this United Health chaos.
Sure. United Healthcare is the largest healthcare company on earth. Their annual revenues are on the order of $330 billion a year and about $8.9 billion in profit per quarter. And to put that in perspective, if you went from here to the sun at $1 a meter and back, which is 147 billion meters, you would still have the profits of United Healthcare left over. It is a company operating at a financial scale that is inconceivable to humans. And they, we think of them as a health insurance company, and that's part of the business. But when the Accountable Care Act was being negotiated, they recognized that there was a threat to their business model, which is at a certain point, the Department of Justice won't let you get any bigger as a business. You become a monopoly. And in terms of the insurance part of their business, they had kind of hit that limit. And so a choice was made internally, and I actually know some of the senior executives because they're friends of mine now, who made the choice to pursue vertical integration. And that meant United Healthcare would create a subdivision, which is called Optum, that is, or at least started as, healthcare delivery services. And so the insurance company owns the thing it pays to deliver the care. Optum then went on to kind of hold every other acquisition made by that company, which includes a lot. So they have a specialty pharmacy. They have an analytics department called Optum Insights. Optum RX is the pharmacy and specialty pharmacy. They have their own pharmacy benefit manager as part of that, so they reprice drug claims. And they pay themselves, billions of dollars every year, 90 odd billion, just from their own internal, like they're the insurance. Oh, I'm so sorry.
No worries.
That's my Spruce Health. That's my one of my favorite technology products in healthcare is the ability to um to talk to patients in a HIPAA compliant manner.
I love that.
Because it's life-saving. I'm a psychiatrist, and one of the most important tools I've had with all the fancy brain stimulation, I do accelerated transcranial magnetic stimulation with fMRI guidance on the regular. I practice in Brooklyn at a place called Fermata, and in Sunnyvale at a practice called Acacia Clinics. And my kind of beginning of my journey of being so concerned with healthcare and knowing all this about an insurance company, which I do not work and never have, is that I just wanted to get a treatment paid for my patients. And so that led to me learning, oh my God, there's this massive series of companies, and United is the biggest of them. It's not the only, there are other companies that are just, unimaginably huge also, but United has successfully pursued a degree of scale and vertical integration that no other company has. And one part of that is the acquisition of a company called Change Healthcare, based in Nashville, Tennessee, which was itself a series of acquisitions of almost unimaginable scale when it comes to the backbone of healthcare, much of which is highly antiquated in terms of its technology.
What does Change Healthcare do?
So my bet is if you took, because yesterday, Andrew Whitty, who's the CEO of United Healthcare, testified in front of Congress, and nobody asked the one question which I was hoping they would ask, which is that.
Yeah,
So
because this is what I ask about
yeah,
all these companies.
what does it
I'm
do?
like, what do they do?
So
Because what they do is something almost like science fiction, almost that doesn't exist,
no,
like in
no,
the future.
I don't know, not at all. I think it's technology. It's like aliens from the distant past left us Change
Right.
Healthcare.
Right. I love that. Yes.
But
Yes.
it's so boring and stupid and broad that it's so. For example, Change Healthcare is just a bunch of companies they acquired over and made one company, and it was like a private equity roll up. So they bought one company that did claims processing, and another company that did image services, and another company that ran the medication dispensing systems inside of
Oh, I
hospitals
see
called
what you're saying.
Pyxis systems, and another
Yeah.
company, and all of those things were disparate. They're different. They had different code bases. They had just, but you need them for healthcare to work. And so they, like, Optum has its own bank. They have a $300 billion a year legal bank. So when cyber hackers using an open portal with no multi-factor authentication required, all they had to do was hack a password and they were in. Like, they didn't need to do any fancy social engineering to get someone to disclose their token because they hadn't turned it on.
Wow.
And so this company has, this is protected health information under HIPAA, and it was not protected. It was between 4 and 6 terabytes, depending on who you believe, of all of our health information, with 15 billion healthcare transactions every year, which can include the bank information, the person, their birthday, their medications, their medical conditions, everything you'd never want all of the dark web to know was breached. And essentially the entire thing has been, as it existed, destroyed, and they have to build it from scratch. Because once you have the source code, which they got very quickly, like on the order of days, you're done. You're sitting duck for the next exploit, because hackers can see what all of the entry points are. So they have to build it from scratch. And they had earlier that month, fired most of their cybersecurity professionals.
Wow.
So and all of this is not because they're bad people or anything like that. It's just there are a series of decisions. Like, I think if you took a senior executive at that company and put a gun to their head or their children's head and said, "Tell us what your company does. It's all we need. Just describe
Right.
what your." I don't think they could do it. I think they'd be dead. I think
No.
their whole family would be assassinated by, trivia nuts. But for example, Social Security disability determination, that's handled through Change Healthcare.
Okay.
Pharmacy repricing. So there's what's called a pharmacy switch. So when you go to the pharmacy and you get your medicine, they have to decide what it's going to cost you, what's your copay going to be, what is your co-insurance, what is the bill to the pharmacy benefit manager, which one is being used in this context, depending on whether you're using a rebate card or it's your insurance or your blah blah. All that stuff has to happen in the background. That's part of Change Healthcare. There is a
Okay.
clearinghouse when you see a patient as a health professional and submit a bill with a CPT code, an own product of the American Medical Association, for which every American pays on the order of just under $18 per year for the privilege of. Those claims get submitted and they get adjudicated, and a lot of that goes through Change Healthcare because it's actually multiple clearinghouses. So Optum not only had Change as a clearinghouse, it has an entirely other clearinghouse to process claims that it happened to own.
Right. And they were
Massive scale, and they
well,
didn't turn on two-factor authentication, and because of that, cyber hackers got the information on every member of our military who got a prescription in America,
oh wow.
for example, etc. It's a phenomenal scale of information. And one of the things that's important to understand is that HIPAA includes a backdoor for law enforcement. So we think about HIPAA as a privacy law. It's not. It's a data sharing law that provides penalties for people who are sharing data inappropriately in theory, and only the federal government has the right to enforce those. There's no private right of action under HIPAA. You can't sue somebody because of a HIPAA breach. You can only report it and hope the Department of Justice enforces it. California actually has a private right of action in its data security laws with much lower limits on how much you can claim, but that may be a big deal for them in the future. But it allows for lots of sharing. And so one of the reasons I suspect like we have this massive scale of this company is because it did allow for the government without a warrant to see a lot of information about us if they wanted to.
Yeah, that's crazy. I also read that they were Optum was trying to get their own codes, like their own CPT codes.
Well, that I mean,
They were
I don't know that that's the case because you can't. The American Medical Association owns CPT codes; it's their product, and they have a negotiation with the government, so the government has to use their CPT codes through a contract they have with the American Medical Association.
right. And that's when did you listen to that whistleblower where there was that nurse asking a question? It was an
Yes,
article written and that's
yes.
what she said. She was like, "Oh, are these codes that you guys are generating? Are these different codes?" I'm guessing that's what she was talking about, that they were going to make up their own codes. I was like,
So,
"How is that possible?"
so that's my understanding. That was a little different. The tape, and look, this is for the Department of Justice to handle, not for us as
Right.
citizens. But what it sounded like was they were having conversations about a payer deciding what the billing rate should be or what should be coded.
Oh,
And
okay.
so, as you know, as a nurse practitioner, as a physician, we make an assessment, a diagnosis, and we submit a bill. And because there's a prohibition on the corporate practice of medicine, you can't tell us what we did if
Right.
you're not a doctor or a nurse who has a license to practice uh, your profession.
Sure.
Um, so your the suits can't tell the health professionals what to bill and what to code, and there was a strong sense that there was guidance coming from corporate about what should be billed or coded, and a lot of that has to do with Medicare Advantage plans because
Okay.
those plans make more money when there are co-occurring diagnoses.
Right. And so that brings us to the project that I consulted on. So in 2019, I was dating this guy who had a creative agency, and he was like, "Oh, hey, I might have a project for you to consult on." And I was like, "Oh, cool. So he brings me onto this project and what they wanted to do, and it was exactly what they're talking about. Um, so basically they were saying their EMRs, their electronic medical records were inundated with data. There was too much data. And the way that the project manager described it was she was like, it's like a data monster. I was like, data monster? What does that mean?
I think I saw that episode of Teenage Mutant Ninja Turtles once.
I know. So it was the weirdest thing I've ever had to consult on. And I've worked for a pharmaceutical company. I used to work for AstraZeneca for about 2 years as a nurse marketer. And they kept changing our title and never telling us what we were actually doing. And it was for an oral antiplatelet drug. And basically, they had noticed, oh, look, everybody listens to a nurse. Let's get the nurses to market our product, and it's interesting. And then I started watching how these companies change their brands and how they come up with these gimmicks. Well, anyway, going back to this project. So basically the EMRs have too much data. And so they were trying to develop an AI technology that when a patient comes in, let's say for diabetes, and if they were non-compliant, you would see the common complaints that they would come in. And so the AI would take out these common complaints that they could bill for. And basically, how they were promoting it was like, well, it's going to help the patient so we can better take care of them. But then if they come in and they're non compliant all the time, well, they're not going to be covered by their insurance anymore. So I spent many, many hours. I didn't know what AI was at that time. I didn't know what machine learning was at that time. And the guy who owned the company that I was dating didn't know anything. I was like, hey, I don't understand this. Can you help me? He was like, well, that's why I hired you. Like, okay. And I had worked at Children's Hospital for about 6 or 7 years, and I was the AI. So basically, I was prepping kids and clearing them for surgery to go under anesthesia. So you can imagine, I saw every kind of surgery under the sun. I saw that one kid, that rarity in the world that just came to us. And as you can imagine, and I worked there from 2007 to about 2013. And we had like just paper charts still. So the charts were like volumes and volumes and volumes. So we're like a real AI going through these charts, calling several different hospitals, several different doctors, just hunting people down to get up that final, like yes or no. What do they need before they go to surgery? Do they need a cardiology consult before? Do they need, whatever, ENT consult to see, whatever, right? So as we were going on, I was on these calls with these Optum guys, and I was like, who is Optum? And at that time, there were $1 billion company. So they were started in 2011. And at 2019, they're already worth $1 billion. I was like, what? It was absolutely insane. So I was like, okay, I don't know what this is, but I'm just going to go with it. So on these meetings, these guys sounded like used car salesmen. They didn't know what they were talking about. They had no clue what healthcare was about. They would just be like, oh, and they had this weird sense of narcissistic authority. And it was bizarre. I was like, what is this? You know? And then coming today, I just worked on it. I got paid and it was done. And I was like, okay. And then all of a sudden I started seeing Optum everywhere. All these clinics started getting bought up. And I was like, oh, wait, here's a company I never knew of before. And all of a sudden they're all over the place. COVID happened. Telehealth all of a sudden takes over. And there you are. It was like this weird corporate healthcare takeover that just started rolling out and happening.
Yep.
And then all of a sudden, I was, I first saw a nurse talking about it and I listened. I was like, oh, that kind of sounds like what I was consulting on. And this is what they were trying to do. But it seems like there's a little bit of a nefarious thing where they're trying to change a diagnosis. And didn't they send them to an offshore company for billing? Like, I think you were talking a little bit about that.
So I'll a lot of the like any business, right? They're trying to optimize this and that and make things more profitable. And there are some difficulties with that if you're working at the combination of Optum or United Healthcare. The issue that frames all of this that's important to understand is the medical loss ratio is their god. And that means we capped their profitability. So the percentage of profits they're allowed to make is limited. And if you're going to give one of my children ice cream and tell them you can only eat 20% of the ice cream, but not put any limits on how much they can scoop out, you will see the problem very quickly, right?
I love
So
that.
if you're a public company, which they are, and you have government contracts, which they do, and you're the largest company on earth, and you're told you can only make 20% profits or maybe 30% if it's Medicare Advantage or something, how do you make more money? Well, you need 20% of more. There's no limit on how big more can get. And so one of the ways to make more is to charge more, because then the cost goes up and the percentage of the cost that you get to keep as profits goes up. So Optum charges United Healthcare for the privilege of doing lots of things, but it's in the interest of both United Healthcare and its wholly owned subsidiary Optum to charge more, because if the costs go up, the profits go up, because it's a fixed ratio. For every dollar they make, they get to keep on average 20 cents in profits. So if you're on both sides of that table, how much does it cost? Well, more every year is the answer. And nobody in any individual silo actually has to understand how the whole thing works to have incentives that are disastrous for all of us.
Oh my gosh, yeah.
So I'll give you a really simple example. If you have depression that increases general medical expense by about 44%, that number is from a company called the Validation Institute, which does independent assessment of cost effectiveness in healthcare. So if your money is made by a percentage of total cost and depression makes total costs go up, would you ever want to effectively cure depression?
No, of
No.
course not.
It
Right.
would be financially daft. You'd be destroying shareholder value, and you'd be violating your fiduciary responsibility to your shareholders as an executive. But can you look in the mirror and say, I'm going to make depression worse or never cure it? No, because you'd feel terrible. And the easier way to deal with it, other than knowing what you're doing, is to never know what you're doing. And so if you take enough silos and enough executives with enough very narrow experience in their very narrow area of expertise, and you never let them look at what they're doing, because the second they start questioning the matrix, they're a bad cultural fit and they're out.
Right.
Then what you
Sure.
get is, like, if you run United Healthcare, the costs can't go down. You have to talk about it all day long, but you can't actually do it because it would make your earnings per share go down. And your job is to not let that happen. Your responsibility is to not let that happen. And so don't do that or you will be fired.
Right. For sure.
And so we have this very strange situation where I don't think anybody honestly knows in any senior position what their company does at
I
any sort of
totally
granular
agree.
level.
I totally agree. I
So
found that out in pharma. I was like, okay, what are we doing? Nobody knew.
Yeah.
Nobody knew.
But I think it's impossible to know. At that scale, it's literally impossible to know. And it's a little bit like, it's Kafka-esque, because if you were to wake up
Yes.
and have a sense of what you were doing, which is creating a world with more incurable disease at greater expense, you would fall into despair and hopelessness. And not everybody can be soothed by 25 million a year in total comp. I mean, the CEO of Cigna got paid $1 billion last year.
Oh my God.
Last year. And they are a tiny fraction. They have a market cap of like 89 billion, and United is $500 billion.
That is so crazy. But isn't Cigna on the chopping block as well?
Um,
Like they're having some
Cigna,
issues too.
I mean, they all do, because these
Yeah.
are unimaginably large companies that, quite rightly, are having investigations occur. I'm friends with Wendell Potter, who's the former head of communications for Cigna.
Oh wow.
And he testified in front of Congress about this, but I asked him, like, when you were at Cigna, did anybody know? He's like, we didn't. Anybody who started to kind of like ask the wrong question, like everybody looks at you side eye and you're out in a year.
Yeah, for sure. I asked a question when I worked for pharma and I got locked in a closet. I kid you not. I
But
kid you not. I asked a question. This lady brought me into a closet. She sat me down and she
like
look.
a literal closet.
She literally put me in a closet and she sat me down and she goes, look, you just have to follow the script. Don't ask questions.
And like, no, here's the thing that blows my mind, and I do want to emphasize. It's really hard for any of us to understand what it's like to be in those roles. And it's just as hard for the people in those roles to have any sense of what they're doing. And so there is this, like, if your company makes $8.9 billion every 3 months,
Yeah. Wow.
anything you do to stop that is not a good day for you.
Yeah.
And so it's a giant, unimaginably complicated machine that prints money at the expense of all of us.
Wow.
Which doesn't mean bad people. It does mean the incentives for that system are catastrophically misaligned with what is best for all of us.
On a patient level, I'm hearing from my patients who have United Healthcare that they get denied. They can't go see a specialist, and in pediatrics, like most of the stuff that you do is referrals.
Yeah.
I had a patient who was having like absence seizures, and the mom was catching them on video, and I think so she finally goes to see a neurologist, and the neurologist doesn't do anything for her. So she comes back to me, and then she finally captured the seizures, right? And I was like, oh yeah, for sure, and she's like, where are you going to send me, because I have United Health? And I was like, you need to change your insurance.
If
And
she
I
can,
go,
my company uses United Healthcare. That's
uh-huh.
we through the professional employment organization that we contract with. United is the only option for my employees.
Wow.
Yep.
Yeah. So,
These are not bad companies per se with bad people. They're incentives that we've all agreed as voters and
yeah.
taxpayers to allow them to follow that are not good. I'll give you just a really, like, imagine a system where kid comes in with seizures. Are seizures expensive if they get worse?
Yes, of course.
Is it cheaper for seizures to get better?
Yes. And so they're not
So,
gonna, right, right.
but you never have to know you're making that decision. You just have to make decisions that lead to the outcome of more money.
Right.
And so, well, we have to ask for prior authorization on that drug because it's expensive. Well, who decided what it cost? Well, also us. Fun
Right.
fact. So we decided the repricing on that drug, but we have to negotiate with ourselves about that drug because it's very expensive. We're trying to control costs. Now, in the time it takes to do that, it's likely that the condition could get worse, et cetera, et cetera, et cetera. So none of the individual decisions need to be evil for the outcomes to be horrific.
It's pretty crazy, but these voters who are voting on these things don't even know what they're voting for.
How could you?
They don't. I mean, and it's so sad because I even see just basic stuff around, and I'm just like, nobody even knows what they're voting for. Like, for example, my dad, who is 90 years old, did a research study with all his friends, and he started calling them and asking them. He's like, how do you know how much your property tax is? Nobody knew. So he calls me up and he goes, do you know that none of my friends know what their property taxes are? Nor do they care about getting them decreased, or where is this money going? So I started doing the same thing. I started asking people, hey, do you know how much money you pay for property tax? Nobody knew because it's meshed in with their mortgage here in California.
But at
Many
least you know
people.
what a mortgage is, and at least you know what a tax is, and at least you know what a dollar is.
Right. And a lot of people don't know what that is.
And in healthcare, I'll quiz you, and this is not to make you feel bad; it's just to prove the
Right.
point. Um, what is a general purchasing organization?
See, I don't know what that is.
So, a general purchasing organization handles contracting between hospitals and distributors. And the CEO of the hospital, even if it's a public hospital, gets a percentage of the total purchasing bonuses paid directly to their paycheck. They get to take home
Wow.
money legally from buying more expensive normal saline.
Wow. Yeah.
And they get more money in their paycheck if they buy more of their money through one of the two national general purchasing organizations.
It's so crazy. It's like,
But the name
I
means
mean,
nothing. So why would you
yeah,
know it's a legal kickback? Because they call it a rebate. Right? If you
right.
call it enough different things at different steps, nobody can follow it. Nobody. I'm obsessed. I read a daily healthcare newsletter. I think this stuff's really funny. I make weird TikTok videos about it, trying to explain it to myself, frankly. I don't get it. There's no way
Yeah.
anybody can possibly get it. It's a level of complexity that quite naturally boggles the human mind. And here's the thing that just take a minute. I told you Optum's legal bank.
Hmm.
The cyber criminals who, are criminals and committed a crime by breaking in and committing a ransomware attack of Change Healthcare, they stopped a health insurance company's ability to pay. And they own the bank in which the interest accrues when they can't.
That's so crazy. It's like, it doesn't even, this stuff doesn't even make any sense.
So do the math at the current 8% per year compounded daily on $300 billion a year in claims not being paid out for a month and a half. They made more money on the Change Healthcare attack during it. Now, they'll lose probably more later because blah, blah, blah. I don't know. But not enough to matter because they make $8.9 billion a quarter in profits on just on literally interstellar distances
Yeah,
in scale.
for sure.
Between here and the sun, that's 147 billion meters. So we're talking just about, we can't imagine. We literally can't imagine it. And if you can't imagine it and you can't describe it and you can't understand it, what chance do we have of
Exactly, to
regulating it
stop it.
appropriately?
Yeah.
I don't see it. So I make fun of it.
Yeah.
I do comedy. It's the best lame comedy in the frontier
Yeah,
psychiatrists.
and that's all you can really do to actually bring awareness to it at this point. I had seen some other doctor when I was doing research for this episode, and he was doing the same thing in 2021. I was like, wait a minute, and he's like a dermatologist, I think.
Is this
And
glaucoma fucking?
yes, yes, I think
Ophthalmologist. Yeah,
so.
he's great.
Yeah, yeah. So and he was like, da, 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 and he was kind of doing the same thing. And I was like, okay, but I don't know. It should be interesting to see what happens. I think that maybe there's going to be a turn and, doctors, nurse practitioners, healthcare professionals are going to be taking healthcare back. I mean, we also saw that look what happened with Walmart Health. I
Yeah.
mean, Kaiser did the same thing. I went to a Target clinic, which actually was really cool. I really, really liked it. It was very modern. I walked in, I was like, this is cool. Nobody's here. I need a physical exam. I go, this is what I need. And the nurse practitioner that was there, I think she was pretty new, but she was very standoffish with me. I was like, hey, you look familiar. Did you go to UCLA? Da, 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 and she did not want to connect with me. She was rude. She was overworked. She's like, I go, wow, this is so cool. You don't have anybody here. And she goes, I still have charts to do. You know, I was like, okay. I go, I would love working here. This place looks cool. But what I found with people who work at CVS has them too, the little minute clinics. People who work at minute clinics are not very happy. I mean, they're working in a box all day. I get it, there's no sunlight, you're in a box. I think that's what it is. I mean, I work with kids all day, so I have to be entertaining. And I'm always like, whoa, you know. And so when I go to see a provider and they're like, hello, can I help? And they're like, and I'm just like, whoa, come on.
No.
Be entertained, connect with your patient somehow, even for one little thing. Hey, I like your shirt. That's
Yeah.
cool. It just makes all the difference and stuff. But
I mean, I'm blessed to be a pediatric subspecialist. So
yeah, me too. Yeah, me too.
kids will keep us honest. I do think there are meaningful opportunities to change things right now, and so I'll share some of those with you if you want them.
Sure. Yes.
So I have a video about it if people want to see it on the TikTok, and I write articles about it. One of them is that for any of us going into an emergency room, you have the ability to control how much you're billed.
Oh, that's right. I've been watching those videos.
There are two ways this matters. So first is in an emergency room, the Emergency Medicine Treatment and Labor Act, or EMTALA, is a federal law. And if hospitals don't comply with that federal law, they lose their Medicare funding and they can't do that. So the federal law is around emergency treatment. And so if you write a phrase that's along the lines of superseding all other consents. I will consent to up to two times the Medicare rate for the appropriate service billed at the appropriate rate for this service. No, they can't bill you more than that. And so the charge master, which is like the master rate card in hospitals, is usually thousands of percents more than that. And so the reason it costs so much is because they made it cost thousands of percent more, so that when they talk to United, they can negotiate a discount on thousands of percent more. So they can say, we saved half off. Yeah, but of what? $1 billion. Yeah, but it costs $10. Yeah, no, but we have a discount on $1 billion. You saved $500 million on the Band-Aid, right? So that's when you go into a hospital or doctor's office, you're signing contracts, and you don't have to sign them. In the ER, by law, the ER has no ability to force you to pay their rates, because you can write that statement and they can't successfully go after you for more later. The other thing to know is if you're in the 60% of Americans who make 400% or less of the federal poverty level on an annual basis, and for many hospitals, it's actually more than that, those not-for-profit hospitals have gotten not-for-profit, aka no taxes status, because they agreed with a part of the IRS tax code called 501R. It's a subsection of the tax code. And in order for them to keep their not-for-profit status and not have to pay taxes, which is a big deal when you're billing billions of dollars a year, they, by law, have to provide free or reduced priced healthcare to everybody who makes 400% or less of the federal poverty level. And in some places, that's up to 600% of FPL. So for a single individual, that's about $54,000 a year. For a family of four, we're talking about $108,000 a year last year, and it goes up a little bit every year. And so for most people, you walk into the hospital, and whether you have insurance or not, you are not obligated to pay the bill. You can ask for the patient assistance program that by law they have to offer you. And so they hand you that consent form on an iPad. Don't sign that. Ask for the paper version. Mm-hmm. And you can write, I do not consent to this form.
Yeah, I've seen that. I've seen people doing that on TikTok. Yes. They've been showing it a lot. Right. Yeah.
And so there is, there's a lot of completely bonkers, like sovereign citizen stuff, which isn't real. Like you can't not pay your taxes. Sorry. IRS, but those hospitals are they're in that same position. So the irony is like the sovereign citizen folks who I believe to be bonkers, incorrect was what I mean by bonkers. They're not correct that you can not pay your taxes. I don't think that's a thing that you can get away with. But the hospitals have made that same deal. So they're not paying taxes. Right. And the reason they're not paying taxes is they signed a contract with the IRS that they're going to offer most people patient assistance on their billing if they make less than X amount of dollars. Wow. So for all of us, it makes sense to ask for the patient assistance program. And if we qualify, we qualify. And it's both if you're insured and if you're not. It's $1 trillion short. Wow. Like they're overbuilding Americans by at least $1 trillion. For
sure.
Because health insurance companies are agreeing to pay thousands of percent more than they legally have to, because it makes the cost go up, and it makes the profits go up.
For sure. I mean, it's so crazy.
But it's completely bonkers. But most of us have the power to either tell our friends if we happen to make more than that. Aw, shucks. Mm-hmm. But if we're in that cohort of people who don't have infinite money, which is most people, most hardworking people don't have the kind of money for that, they aren't obligated to pay that full sticker price. They have the opportunity to request patient assistance, and by law, it has to be offered. And so ask, and don't consent to just any price. Ask for the patient assistance program. And when they ask you to write your signature, you can write, I do not consent. And it's really hard to send someone to collections who wrote, I don't consent to this bill on the legal contract that they're asking you to sign. If they hand it to you on an iPad, just write, I do not consent instead of your name. Because then when they pull it up and they try to shove that bill down your throat, you just say, please send me the form where I consented to this. And when they go look it up, it says, I do not consent, not your name. And it's not fun for every hospital visit and every time you're seeing a doctor to be like a legal fight at all. But it is your right. And it's nurses and doctors can educate their patients that they have these rights. especially if they're working in settings where they don't agree with policies. Educating their patients about what's lawful is, allowable. It doesn't mean they're gonna love you, but that is, you can communicate important information about the health status of your patients and their ability to access care all day long, and should. We're healers.
We're
Our job
healers.
is
We need
our
to
job
take
is to
care of
heal.
our, yeah, that's what we're here to do.
But part of that obligation, I would argue, is advocacy.
For sure. For sure. And a lot of people just feel that they can't do anything. And it's like, I was listening to this one nurse saying, she's like, oh, a doctor got forced to sign a non-compete. And I was like, nobody put a gun to that doctor's head. I
Those are
get
all
it.
gone now, by the way.
Yeah, those are all gone, which is great, because there was
Huge.
probably a lot of doctors going, I'm not going to sign this. You know, I go, nobody forces you. That doctor could have gone to work locums for a while. You
Well,
got to be like,
I think this is where we have regulators for a reason.
mhm,
Because when every job has a non-compete, then where are the jobs, right?
exactly.
Doctors and nurses like to follow rules. That's why we're in healthcare.
Right, right. That's what we're taught. And then all these
Right.
crazy insurance companies are doing all these wild, psychopathic things
Well,
where you're just
things
like,
things that don't make sense.
things that don't make sense. Anyway,
Uh,
we have like a few more minutes. I kind of wanted to jump
sure.
into Stalking and the show, the
Baby
Reindeer
reindeer.
show.
Yeah.
Yeah, Baby Reindeer. I saw it, but I want to hear your take on it. I have a little bit of a different take on it through a writer's perspective, but yeah, you had a stalking incident.
I've had more than one. I actually have active litigation here in the state of New York for defamation.
Wow.
And on May the 8th, we have our anti-SLAPP hearing. But I have been harassed for years. And stalking is a crime. And that's a crime that the government enforces, right? It's not a civil claim. And so the difference between what you can sue about and what the government can take action on are different, right? So stalking is something that many, I have been the victim of in the past, I'll say, and it's not necessarily related to my civil matter. But I've been threatened with death on
Oh,
more than one
wow.
occasion. There's a law called the Tarasov law, or that's the ruling, the court case where somebody was killed and there was an obligation to warn. So I've gotten phone calls from colleagues on my birthday saying, just so you know, there's someone here who saw you for a couple visits and they've threatened to kill you, and so we're letting you know. That's not a great phone call to get. So about 25% of psychiatrists are stalked. Those are the
Wow.
numbers. And 18% of those individuals will have violence done to them at some point. It's really high. Psychiatric nurses are particularly vulnerable. The numbers aren't as great, but I would suspect they're similar, if a little bit lower than the actual psychiatrist. But there are many more nurses, right? Nurses are some of the highest rates of workplace
Violence, for
violence,
sure.
and it's horrifying. Nurses, I mean, my life has been saved repeatedly by nurses, and I don't mean that figuratively. I mean literally. I have not been beaten to death because nurses saved my life from that happening in hospital settings. So it's tremendously serious because it sucks. No one should have to have that happen. Like being threatened
No,
with death causes trauma.
well, for sure.
Being physically or verbally attacked, in my case, a lot of harassment has taken place, or defamation at least, on the internet, where people are saying things that are false and harmful.
That happened to one of my guests as
Yeah.
well, a psychiatric nurse practitioner, and she was harassed, like really, really bad by a nutritionist, I think. And yeah, it was really crazy. Like they even called the board, and it was a group of psych NPs that were on TikTok and that kept being harassed. So they had
It's
to bring the police, and but
horrific.
yeah, it was really crazy.
Yeah. And so the show Baby Reindeer is a good example of fictionalization lightly of stalking, right? Where somebody has someone who is doing stuff. So stalking is a crime, and it's defined as taking actions that would put a reasonable person in fear of their life or the life of a loved one or the life of a pet, or their career, etc. It's acting repeatedly to cause psychological distress to another. And
Or
there are different levels of criminality there, but like as a citizen, like I don't have the right to enforce that. That's the government's job.
mhm.
So the private right of action any of us have if we're being, you know, defamed is to bring a civil lawsuit. And so I was unfortunately forced to do that because a person had been saying things that are false and defamatory that are just kind of absurd. Like, I'm friends with Jeff Epstein, who I've, of course, never met and is dead, by the way. I'm a rapist pedophile.
Oh my God.
Yeah, awful stuff.
That's really bad,
Yeah, uh, just like voter fraud. I've been accused by the
voter
individual of
fraud.
voter fraud. Yes. Like it's just, and the thing is, you'd think
Yeah,
no one would believe it, but I'm a physician and a psychiatrist, and there are kind of two groups of people who will look past page one, and those are future patients and
for
investors,
sure.
right? And
For sure.
everyone worries that it might be true. It doesn't matter how absurd it is.
Yeah.
And so the show Baby Reindeer does a great job of depicting the kind of paralysis in anybody having something so strange take place. Like nobody thinks someone's going to contact them endlessly. They think it'll stop, and on average, it does. It's only about
Yeah.
10% of stalking cases that persist past a year. And 5 years is very rare.
Wow.
Um, but there are people who can't drop it, and are unwell in ways that let them continue pursuing people in ways that make sense to them, but not to us. And many physicians, not just myself, are the victims of this sort of thing, and many more are physically harmed by people who have things going on in their mind we don't have access to. So
Yeah. I myself have had I had a patient's father call the office and say he was going to cut my head off. Yeah, and I took that very seriously, whereas the person who took the phone call didn't. And I was like, "This is
yeah,
serious. Like, I have to report this now." I go,
it is
"You
a
realize
threat to
that?"
your life. Yeah,
That's a
and
threat to my life. There's no, I go, I'm very open to working with anybody. And this individual hadn't even come to the visit. I go, you needed to have him talk to me. I would have, if he wanted me to do something else, I'm happy to work with him. If he thinks something else is going on, but just to like threaten me.
so
One of the,
there, it's
go ahead.
bad, and it's also there's a difference between one threat and
Many.
years of
Yeah.
threats.
Sure, sure. My problem with Baby Reindeer was the guy had first of all, I felt he was taking advantage of so the protagonist was taking advantage of all these other characters in order to get to his goal, which ultimately was to create a show. I
Yeah,
mean, sure, he was here, being stalked by this stalker, but he also was giving into the stalker. I mean, he was kind of like feeding the beast in a
which is
way.
extremely common.
Is it really so he was
Yeah,
feeding the beast to get that positive reinforcement that she was giving him.
right.
And
And
she even helped him with his show, kind of. She shows up at his show,
yep,
he's bombing, and all of a sudden, because of her, people start to laugh at him,
right.
you know? And so she becomes part of the show in essence,
Yep.
and he gains this confidence, and then he has sex with her. So I was just like, wait a minute, you know?
So there is a really, for many people who are victims of this, it doesn't start as the same way it ends. You don't necessarily know in the beginning that people are going to turn into stalkers. Um, there's kind of a playbook. There's often someone will start out by being, insistent and showing up more than might be appropriate, but saying very nice things, or oh, you're the best. I love you so much. I just can't, like that's we make romantic comedies about behavior that would be stalking.
Right, right.
right? And so a lot of that's normalized. And so if someone's being, theoretically nice to you and what's the difference between a fan and a stalker? Well, it turns out that line isn't clear while it's happening for people. That's my takeaway. And obviously, it's a TV show now. Like, it's not the person's
Right.
real life. I can say that the actor in the show is the person that happened to, because he said so.
Because he
And
said so, but I
yeah,
have some issues with that too, because there's a book called Enduring Love. Have you read it? It's by
no,
a British Ian McEwan, which is really good. And there's also a movie that was made in 2005. One of the things about the book and Baby Reindeer, there's a scene where the stalker talks about curtains and something like seeing the guy through these curtains. That's in the book, Enduring Love. So I'm like, wait a minute. And so I just read the book. And so I
yeah.
was like, wait a minute, this is too much like Enduring Love, you know.
So, so I don't know what happened.
Exactly. We
I
only know from
do,
his accounts. I don't know about
I do
his.
imagine because I'm a writer also,
Right.
and I know writers, and often what happens
Good. I'm
is it's hard to take a real life experience and turn it to something that translates into a TV show. You have to do some editing and some fictionalization because essentially real life is weirder than TV. And you have to make it followable. And one of the ways to do that is borrow from historical tropes.
sure, sure. And Enduring Love is a great, like when I read it, it was actually purchased by a criminal attorney who gave it to me. We went on a date. He was like, "You have to read this book." And he gave it to me and I was like, "Oh, this is like really good, you
Sounds like
know."
a good date.
Yeah, yeah. Oh, he's interesting. He puts psychological diagnoses on a lot of his clients. He's a very well known international criminal attorney. So he's fascinating. Anyway, um Enduring Love. So I read the book, I watched Baby Reindeer. Having experienced stand-up comedy myself in Hollywood, I was like, yeah, I don't know about this. Because sure, he was at the Edinburgh Festival. That's where he got noticed. He did it many, many times. But I don't know if you really want to become a comedian, like how I did it. I actually stalked someone in a good way, in a good way. I was following one of my who became a good friend of mine. I just would go to all her shows
You
and
were a
I would sit,
fan,
yeah, I was her fan.
right?
Exactly. I would sit with her and she would tell me, about how she did what she was doing and she got me to do a one person show and she got me to do my nurses and hypochondriac storytelling show on stage,
Yeah.
so I guess it's a little bit different, but it to me it was I never did anything to harm her or anything,
I'll hone in on it. What matters, and this is you've made a great bridge between disturbed behavior and medical care.
right.
Context matters. So, in most contexts, cutting into someone with a knife is assault.
Ugh, right.
If you're a surgeon and you have a medical degree and the person you're cutting is a patient and it's an operating theater and the charge nurse has prepared the patient so that they will be sterile, etc. Now it's under the combination of ethics and law that make for medical care. And so things that would in any other context be assault become okay. Being a fan is like less contractually bounded, right? But there's
Right.
consent in the
Sure.
process that makes being a fan different from being a stalker. A fan, when somebody says stop it, is crossing a line and not
Right.
recognizing and respecting the consent. So a lot of what we do as health professionals has all the boundaries because what we're doing is invasive and would in any other like the questions that we on the regular ask people would be so unimaginably rude that like so tell me
Sure.
everything about yourself and your entire family. Like nobody does that.
Exactly.
Like
Sure.
just it's why we're like dating is awkward for doctors because we're used to these
Right.
really intimate conversations and we're taking like 9
Sure.
steps back to have a date. Because don't be weird. Right.
Right.
and,
Right.
and so the context around it I think is you can give people like and people get upset, right? I've had patients say outrageous things to me
Oh,
and
yeah, me
also
too. For
It's in the
sure.
context of them being my patient, and so my
Right.
job is to understand it uh, in that context. And there's a limit, right? You can't threaten my children and have that be okay, because then I can't do my
Exactly.
job anymore and think clearly to take care of you.
Sure.
And so for any of this stuff, I think like we the context matters, and all of us kind of have to use some judgment in looking at whatever we're seeing and coming to some conclusion um, as to what's okay and what's expected, and that's where we have kind of measuring sticks and we have laws to guide us, but at the end of the day, there is good sense that we need to check in with. That's my argument.
For sure. I love this. So, Owen, where can people get in touch with you? I did want to talk about your accelerated transcranial magnetic stimulation. If you could tell us a little bit about it
I can do it.
before
Yeah,
we wrap up,
sure.
because I think it's so interesting.
Depression can be over in 5 days. So we took an old technology, which is electromagnets from the 80s, transcranial across the head, magnetic, what it sounds like, stimulation. And we look at a target in the brain, and we stimulate with a pattern of pulses that changes the firing of those neurons, and that can cure, in quotes, bring depression symptoms to remission in a portion of people. We don't use the word cure very often. The definition of the word is alleviate all symptoms of disease. And so I say gets to remission and not cure. But functionally, no symptoms equals cure, at least for a period of time. Of course, we recognize that symptoms can recur. You can have plus, so we don't use the word casually. But transcranial magnetic stimulation, or TMS, is a brain stimulation approach, and we do it multiple times a day. We have one protocol in my office in New York called the SAINT protocol, Stanford Accelerated Intelligent Neuromodulation Treatment, and that's a trial on an already FDA-cleared device, so everyone gets the active treatment that uses a brain scan and finds the target. We're doing another clinical trial with the brain sway systems, which use a larger stimulator, where we don't need a scan, and we're doing the treatment 5 times a day for 6 days, compared to once a day. And the upshot of all of it is your depression can be over more quickly than you thought with no medications. And that's the future. And I'd love to see more of that, and more of that paid for by payers like United Healthcare, who don't have to agree with me, but I wish they would. And so a lot of my engagement with payer models came from doing transcranial magnetic stimulation and realizing that more than once a day would be better for my patients, and that not being possible, and that being really frustrating. And so I've done a lot of work, much of which is published on Google Scholar, et cetera. I write a daily newsletter, thefrontierpsychiatrist.com, which is on Substack, where I talk about this a lot. And I still write, research, publish, and see patients. But depression can be over. It can be over quickly, and we have a variety of ways of doing it. And there are other treatments coming. There's transcranial focused ultrasound. There is trigeminal nerve stimulation. There is vagal nerve stimulation that's non-invasive, et cetera. There's a really hopeful future of brain stimulation for relieving suffering.
So who qualifies? Like, what type of patient would be a patient for accelerated TMS?
So depression, anxiety, OCD. PTSD we have less data. We do it sometimes with brain mapping, with the fMRI. And there's some kind of oddball things that we deal with from time to time, like Parkinson's disease, progressive supranuclear palsy, et cetera. And this is why you have a consultation with the doctor, right? But if you got problems, the thing that happens for many patients who see me is the diagnosis is wrong. And so I'll end up in the process of doing my evaluation, making a highly likely diagnosis of a rheumatological condition and sending them to my colleagues in rheumatology, for example. In addition to whatever, like I'm sad, could be a bunch of stuff. And it might be,
that's what I mean. Is
it
it
might
like
be
I'm sad for
depression plus.
today, or tomorrow I'm okay? Like, for
If you're
example, in
bothering,
teens.
I don't worry about that.
Mhm.
So like, depression's a really common illness. It's about 10% of the population per year. And if you're bothering to come to see me, it's enough of a pain in the ass to do that the chances that you
Exactly.
don't have a problem are low. And I'll tell you, like, if you don't need it, I'm not going to give you a thing you don't need. Like, I'm not going to waste your time. Too many other people are waiting. But it's very rare that people see me and have symptoms that are too mild for me to worry about because they took the trouble of doing it. I mean, American healthcare is a pain. If you're willing to jump through the hoops, it's probably because there's a real problem.
For sure. For sure. Well, this has been amazing. Tell people where they can find you, Owen.
Yep. So thefrontierpsychiatrist.com is my newsletter. Fermata, Fermata.health is my practice website. And I'm on LinkedIn. Owen Scott Muir, MD, is me. And a bunch of other things I do. I do, research around tardive dyskinesia with AI, etc. So around and about. If this is coming out soon, I have a conference on Sunday I'm hosting here in New York, May the 5th, called Rapid Acting Mental Health Treatment. I'm going to be at the American Telemedicine Association on the main stage on May the 7th. I'm the chair of the Emerging Treatments and Addiction Conference, May 15th and 16th in Miami, Florida. And I'll be at, but not presenting anything on the stage, at the Clinical TMS Society in London
Very nice.
in June. And then again at
Fun.
the ACAP conference, American Academy of Child and Adolescent Psychiatry, in October.
Awesome. Super cool. Well, thank you so much, Owen, for being on. And until next time.
Thank you so much for having me.
All right.